virtually 100% of patients, and dentists for that matter, or dental personnel, will tell me they don't like that. That looks artificial, that looks fake. But what is it about it that... Hey everybody out there, Ed McLaren here. I'm back to start doing some new recordings. I haven't done it in a while. As I mentioned in a previous post, I had to take a fair amount of time off because I got a new hip and had back surgery from a time that I hurt myself doing something stupid, actually making one of my movies. So I think my next movie I'm going to make is going to be The Bionic Dentist with a couple of false new body parts, or actually one. Anyway, today what I want to do is pick back up where I did in early 25 with a weekly program, hopefully, I like to call Dental Raves and Occasional Rants. And we had a little group of people that we did during those, I think we did about 4 to 5 sessions. So I think I'm going to start off with, because in those sessions, we had asked for questions. Lots of questions, or any question relative to dentistry, and I got about 250 different questions that I didn't have time to answer. So I thought I'd start off with that session that we call AMA, or Ask Me Anything, and I thought it would be best to do it, rather than just answer a question, do it in, let's say, a masterclass sort of format, where I'm going to go into a lecture right now and explain a couple of images or answer a couple of questions that way, and we'll start out with that format, then eventually get back into interviewing people, okay? All right. What I'm going to do is answer questions through excerpts of various lectures I've done over the years with images, so it's clear on what I'm talking about. And I did an aesthetic dentistry series, and it was 2022, called Contemporary Aesthetic Dentistry, everything that I teach in aesthetic dentistry. And one of the things that I started out doing with is really defining some terms, and those are 2 of the questions that I've got recently. What is aesthetic dentistry? What's the difference between that and cosmetic dentistry, and how can we differentiate some of those things? So I thought I would basically start there. What's the difference between aesthetics and cosmetic dentistry specifically? That's a question I get asked all the time from dental professionals and the lay public, and I'm going to kind of tailor this to both. I'm going to answer both groups' questions, so if I oversimplify a little bit for my dental colleagues, I apologize. And another question I get constantly, to tell honestly, is what makes a smile look fake, or what can I do to make it look great but not fake? And I'll try and answer that question. I'm going to try and keep these to under 15 minutes because I'm going to try and do this mostly on YouTube, and I'll put links on conventional social media like Instagram and Facebook, okay? Let's just define a term for a second. If you look up the word aesthetic in most dictionaries, it's going to read something like this. I'm going to read this. It's responsive to or appreciative of what is pleasurable to the senses, or pleasing in appearance. Essentially, you see something and it causes the emotion of pleasure, and that's the definition of the word aesthetic. Versus cosmetic, if you look up that word generically, it means to do something superficial to cover a defect or deficiency, and secondarily serving to beautify some part of the body. Right now, but more specifically, aesthetic versus cosmetic dentistry, I did a little literature review to see what other people talk about, and this article comes up quite a bit in the literature. Tosi et al., Cosmetic or Aesthetic Dentistry, in Quintessence International, April of '99. You can certainly look it up. Now, this is this group's words. I'm going to tell you, I don't exactly agree with the way they say it in just a second. They define cosmetic dentistry as chosen for appearance improvement, not necessarily function, ideally, and may compromise biologic principles. Then aesthetic dentistry, they define as integrates biologic technology for long-term survival and function, and aims to mimic the pristine state of natural dentition. I sense a strong bias here in the way that they word this. It's an interesting perspective. I could say that I know a lot of so-called aesthetic dentists that do wonderful jobs, we can say that first, okay, but secondarily don't satisfy those requirements that we see there, integrating biology, function, and other things of natural dentition. Same thing on cosmetic dentistry. There's an implication by this team that cosmetic dentists maybe lack an understanding of some of the basic principles of dentistry. I completely disagree with that. I see lots of people that are advertised or call themselves cosmetic dentistry that do fabulous dentistry. They do beautiful cosmetics and what I guess we would define as aesthetic dentistry here. And also we see people in both groups that we would all agree lack abilities in these areas. Okay, so I think I would like to maybe state it a little bit differently here for the audience here. That maybe makes a little more sense and doesn't step on toes, let's say. Looking around the internet and looking around definitions of aesthetic and cosmetic dentistry, I sort of molded this to something like this. That aesthetic dentistry really is a marriage, maybe a poor choice of words, of the art and science of dental treatment. It takes into account, diagnosis, planning, treatment planning, functional harmony, material knowledge, and also aesthetic dentistry. Where the cosmetic part of aesthetic dentistry would be dental work that's intended to improve appearance. The main focus is appearance, color, position, shape, things like that. But most dentists, understand the aspects of both, and they're somewhat distinctly different. Okay. One of the things about cosmetic that maybe comes up for me, and this is my terminology right here, that when we use the word cosmetic in makeup or maybe plastic surgery or dentistry, I think we're implying that we're trying to make something more beautiful, okay? But I think a lot of people think of cosmetics as something that if you do a cosmetic enhancement, it's a little bit more obvious. In other words, we would be able to see it. We would understand that maybe something's been done. I think we try to use aesthetic dentistry to mean something that's a positive improvement, but maybe a little bit less obvious, like putting too much makeup on or something like that. And these terms are obviously open to debate. Now, the one thing about cosmetics that we see over time is we see that it tends to change. Cosmetic values or perceptions change more in time than we consider aesthetic, let's say dentistry changing in time. It's a little bit more fixed. So I hope that helps at all with a definition. Now I'd like to move on to that second question. What is it that causes the perception, let's say, of a fake smile, even though maybe technically that everything was done perfectly? Well, I think social media has contributed a lot to that, which to a lot of things we could argue has contributed to maybe misperceptions of things, because so often we see something like this. We see a before and an after, and we only see a close-up view of this before and after. And then if I showed this to most of my patients, virtually all of my patients, they would argue, or if I asked them the question, which one do they like better, they would always like the one on the bottom, the brighter teeth, okay? But they only have the perspective of the teeth, and they see a little bit of the lips. So few posters, for several reasons, maybe the patient won't let them, but so few posters ever post the full face with it. And that by far is the most important view. So let's take a look. I found, and it's not that easy to find in social media, that somebody actually posted the teeth with the face. This is the same person. Obviously, I blocked the eyes out so that hopefully I don't offend anybody. I apologize. If somebody recognizes this, I'll never use a name. But this is an educational perspective. When we bring in the full face, which is by far the most important view, and in psychology terminology is called gestalt, the full picture, let's say, the full patient. We see, now if I showed this to patients, which I do separately, because sometimes they'll figure it out, virtually 100% of patients, and dentists for that matter, or dental personnel, will tell me they don't like that. That looks artificial. That looks fake. But what is it about it that gave it look fake? Is it just because it's too bright? I didn't touch this image up at all. Somebody maybe did in Photoshop. I have no idea. Okay, but let's delve into that point a little bit. All right, I want you to look at this for just a second. This is a before and an after of a case I did. And close-up view, again, we don't have the full face view. I've showed this to so many patients over the year, and I ask them, do they like it? And they'll tell me something along the lines, yeah, the teeth look better to me, doc, but maybe I don't love it. And some version of that. And I ask why, and he says, well, the teeth seem to have a little yellow in them, and maybe they're a little darker than I would potentially like for myself. And I try to be kind when I told him it was my work, okay? And then, the point of view is that we don't have the perspective of the full face. Now let's look at the full face. Let's bring this in, and I want you to remember what you see here, because we'll come back to this in a couple of different cases, okay? Or try to remember. Now, when I show the full face to patients or to dentists, they love this. They could say maybe a teeny bit brighter, okay? We're basically an A1 shade, okay? But a very nice color, fairly bright in her face. Yeah, we could argue a little bit brighter possibly, okay? But she didn't want to do anything about her lower teeth. So when we bring in the integration of the view of the full face, let me back up for just a second, it doesn't look dark to us. It looks like it blends in her face, and that's a very acceptable to very good smile, okay? Now, what is it about that brings it in? Let me show another case here for just a second. All right, now if I show you this face first, I'm going to reverse kind of the order here so I can hopefully make obvious the points I'm trying to make here, is let's look at her full face and look at her teeth. Now, obviously I said it's a case, so I did the teeth, but as you first see the face, what perception did you get? Whether I'm talking to dental public or dental professionals, did you get the perception that it's fairly bright? Did you get the perception that the teeth are, kind of perfectly shaped? And maybe even a little fake? They are now because I told you, okay? Now, what if I had shown you this one first? Those are her teeth up close. if I showed you that first, maybe not dental professionals, but the lay public, as I do all the time when I'm doing consultations, I reverse orders and things like this, almost everybody will tell me, if I didn't tell them it was my work, they'll just say, well, doc, I think, what is that gray there? What is, maybe I see the little color. What is this brownish stuff between the teeth? And I see this, over here, these sort of white spots, and maybe what's this stuff here? Well, we know what it is. It's surface texture, right? All right, so what it is, basically, what we're seeing is a subtle gradation of color, okay? Maybe you could do a little less than that. We see things that we call halos, these things we call mamelons, we see things we call surface texture at this view, okay? And at this view, if you don't understand this view, how it impacts this view, okay? If we don't have a gradation of color, and here's the point, I'm trying not to keep this too long, keep it under 15 minutes. If we don't have a subtle gradation of color built in that we see at the close-up view, okay, some surface texture, some tapering, maybe a little bit of interproximal color to define the shape, okay, at the full face view, that's when it looks fake, like that case that I showed you before, and I can show you case after case after case. And for the dental professionals, this is a challenge to educate your patient, okay? And I work a lot with technicians. I'm a ceramist too, as most of you know out there, this is one of my biggest challenges. Technicians are afraid to talk to their dentist about this. But honestly, I can tell you probably 100% of what I do is redo dentistry, okay? Very few people will pay me my normal fee the first time the first time I treat them. It's usually somebody that's had a set or two sets of veneers, and the standard fare is they'll say something along the lines, I liked it initially, I don't like it now because everybody knows it's fake. And that's the specific answer to the question. You have to have a little gradation of color. It can be very bright, but subtle gradation. You have to have a little translucency. You have to have some mamelon effects, and you have to have some surface texture. One last case, and then we'll finish up. So hopefully answer two questions well. This is before and after a young dentist that I treated. And again, if you look at this, you might go, well, wait a minute, there's a little too much color here. There's a little too much this. What is this stuff between the teeth? And I see these, what is this strange reflection? And we as dentists or technicians know that surface texture. All right, but let's bring in the full facial view. There's before and there's after. And with the full face smile, it almost looks a little bit too bright. It almost looks a little bit too boxy, but in her face, it worked. Okay, and that's the point. Those are the aspects that need to be in those dental restorations that you can only see at a close-up view, this view right here. All right. The last thing I'd like to finish with, for the benefit of patients out there, I would strongly recommend that you have your dentist do some sort of digital smile design, because I see this all the time. Okay, we see a before and we see an after here, and we can all maybe agree that that's a nice aesthetic result. Okay, we've got 14 teeth there done. All right. But, I wonder, as I look at this, some of these teeth are in fabulous shape. Yeah, we could argue this right here could use a little bit of something here, maybe something over here. Okay, but I took this same case, okay, that was posted somewhere, but no names, okay? And all I did was I digitally put in a tooth right here at the second bicuspid, okay? Just got rid of that bracket, basically bailed the tooth out. And I copied this tooth was number 8 over to number 9. And then I showed this to a lot of patients. Now, I never saw the full face. The full face was not on the internet. I wouldn't show this full face anyway. And I can tell you 9 out of 10 patients, when I show this versus this, the right versus the left, pick the right. Because they say, God, that looks great, doc, nice and bright, okay, all right? And it looks more believable to me. Looks more like real, because it is real teeth, all right? So I would argue that there's a lot of over-treatment that didn't need to happen. Maybe you could argue the patient said something, but the benefit of digital smile design, we can show them these things, okay? And maybe, I get it, you need to do treatment to cover your overhead, but we got to be careful. We need to be careful that we give patients true options. So I like to finish with this. This was something in the ADA journal I saw, 6, 7, 8, 9 years ago, and this really bothered me, okay? Basically what they did is they digitized a set of teeth, and they put basically the same teeth in everybody, okay? Yeah, people want to have nice, bright smiles, but they also want to have individuality. I don't think that this person wants to have the same teeth as this person, wants to have the same teeth as this person. They show all these different characteristics of their face. They're all attractive people, okay? So I think it needs to be the same with teeth. And this is kind of a quote for me. Sorry, that aesthetics to me is not about giving everyone the same teeth. It is about ideally individualizing teeth to the person. Not making teeth white, but making them bright. Bright, beautiful, but believable. All right. Thanks, everybody, and we'll see you next week, hopefully. Oh, and by the way, if you like this, please subscribe, because I'm going to start putting this more and more in contact on YouTube. I don't take any money from anybody for any of this, and it takes me a lot of time. And so I'd love it if you'd subscribe and sign up for the notifications so you get notified when I do something new. All right. Thank you.